This is KLEAN Radio.
Welcome everybody out there listening to KLEAN Radio on our flagship station, 790 KABC, on the World Wide Web at KLEANradio.com. That's KLEAN with a K. And if you go to that website, you could actually look at the studio. You could watch us live. And I want to apologize for the way I'm dressed tonight, but I had a barbecue before this that I had to cook for 60 people at KLEAN, and I didn't get a chance to change. And or on XM channel 243, you could be listening to us right now. In place of Andrew Spanswick tonight is one of the most prolific, extraordinary, sexiest doctors you'll ever find, and probably in the Eastern Western hemispheres. He goes by the name of Dr. Jason Coe.
Hey, Judah. Thanks for that introduction.
I think you should leave that on your voicemail.
It's a little over to the top, but okay.
You know what? Can I say, well, you know, of course the sexy part, that's 100% true. And
well, I'll take that.
Yes. And but I also will say on the Eastern and Western hemispheres, you are one of the best psychiatrists out there. I don't say that for the effect. I personally trust you. And it's nice when you could actually give somebody in the field of psychiatry, in the field of psychology, you know, your own stamp of approval.
Oh, thank you.
And you have mine.
I know you mean that.
No, from the bottom of my heart, I do. And to the people out there that are listening, I encourage you tonight. We have an amazing show. We have two amazing doctors in the studio tonight. We have a writer, a producer who wrote an amazing movie that will be coming out soon. It's called American Addict. We'll get to him in a second, but his name is Dr. Gregory Smith, MD. And one of the coolest things I'm reading in this is that America is less than 5%, Doc, of the world's population, but consumes 80% of the world's prescription narcotics. And that's the subject of this movie. That's an amazing.
We're a pill-addicted society. We think that there's a pill for as an answer for everything.
Where do you think that came from?
Gosh, I don't know. I think people have come to believe that there are easy answers to every little pain or discomfort that we have. And, take a pill, feel better. Yeah. I think of the Rolling Stones, Mother's Little Helper.
Right.
There's such a belief that pills or pharmacology is somehow going to cure every aspect of our life. And that's simply not true. That there's not a substance that's going to make you feel better. I think people are using substances to deal with psychic pain, emotional pain, and they get the two confused.
So for anybody out there that's listening, for everybody out there that's listening, give us a call. The number here is 800-222-5222. That's 800-222-5222. I actually think this is a great topic tonight to talk about pill problems that people have. Last week we read a stat that most teenagers are getting their drugs from the medicine cabinets. And, parents don't realize, you go to the doctor gives you a script for Vicodin. You might not be addicted to it, but all of a sudden your son's friends comes over to the house, sees they go medicine cabinet shopping. And I think that's a huge
problem.
That's a huge problem.
We call that diversion, and that people leave these medicines around. I know a lot of addicts who, the first thing they do when they visit, a friend's house or something is they go to the bathroom and check the medicine cabinets.
Right.
Yeah.
I get a cup of coffee.
Yeah.
And so let's welcome our guest tonight, Dr. Gregory Smith, writer, producer of this new movie coming out called American Addict. What pills are you taking?
Thank you for having me. And I was co-writer. Sasha.
Co-writer.
Yeah,
sorry.
Yeah. I just want to give credit to credit was due.
It was directed by Sasha. You're going to have to pronounce
Sasha Nez, a very great director.
And so you're a doctor. You're a licensed, trained doctor. You started your career as an anesthesiologist.
That's true. I basically focused on pain management and chronic pain management, and I noticed that people were just not getting better and that people were becoming more and more addicted to the prescription pills, namely the narcotics that I was giving them, and I was trying to just figure out a way to make them better. And that's how this all started. And it all changed for me probably about 10 years ago when I realized people are just not getting better. They're just coming back every month to get a prescription, and I was just tired of giving people a pill for a problem.
That's actually, and so what did you start doing?
Well, you really have to, unfortunately, most doctors are not trained in other types of medicine or complementary medicine. So I really had to train myself, go out and learn how to use nutrition as medicine, and other complementary type things, acupuncture, Reiki healing, all kinds of things to help people get better without just giving them more and more narcotics. And then I really started to look at what was behind all this. You asked the question a minute ago, how this all happened. Well, it really is generated by our medical system that is geared to giving people pills for problems because, number one, it's fast and it's instant gratification, and it's good for business. Chronic illness is a great business.
Yeah, I think you're right about that. The medical profession needs to take some blame there. That we've dispensed medicine, to people who, in some ways they don't know any better, and they think that they're getting something, they're going to be better by it, but in the long run they end up worse. So we have the big pharma, pharmaceutical companies and doctors who are kind of going along with it. And, I think they were by and large well-intentioned, but they simply don't understand the treatment of chronic pain.
Here's I don't know if you guys are familiar with the show House, but, the show House was centered on a doctor who's, addicted to Vicodin, and painkillers. And he almost made it cool. He made it this cool thing. He walked around taking his Vicodins in front of people. Like it made him a man.
Right. I didn't realize that. I'd heard of the show, but I didn't realize he was addicted.
He's addicted to Vicodin because he had chronic pain. And he was a genius, so everybody put up with it. But he was
cool.
Right, and he was like, oh, he's just popping these Vicodin, and it made it sort of this air of new cool. Yeah. When I was younger, I saw Bruce Willis smoking in a movie, drinking whiskey, and I thought, hey, that's pretty cool. I love the way Bruce Willis did it. But it's almost like in this new in this century, it's like, look at the way he pops his Vicodin. He makes it look cool, and it was a huge thing of the show. Yeah,
Nurse Jackie is also another show that is similar to that, and it's true that people can function on these medications, and they are legal, and not always used legally, but they are legal, and that's sort of what's created the problem too. Is that because it's not something you bought on a street corner, people think it's safer or it's not as dangerous. Well, in fact, that's the complete opposite. That prescription, more people are dying right now from prescription narcotics than heroin and methamphetamine, cocaine combined. And so we have this war on drugs that we're fighting the wrong war.
Right.
I mean, the real war is the prescription pills. Even drug dealers on the street are preferably selling OxyContin and things like this. It makes more money than the street drugs at this point.
So do you think that people are getting help less and it's taking them longer because it is legal, because there's a certain modicum of functioning, and I mean, are people addicted longer to prescription drugs? That's for both of you.
That's a very good question. I haven't thought of it that way, but in a way it's true because a lot of people get their medications legally, and if someone sees a bottle, they're not going to go crazy because it's not a bottle of crack or something like that. You can keep this thing going longer and longer. It isn't until it really starts to erode at a person. They start missing work. They get arrested. Things start to break down their life. That often that people seek help because they don't think that they're necessarily doing anything wrong.
Doc, what's your opinion on that?
Oh, I couldn't agree more. These are dangerous drugs that people can function on, for a while, but as they get deeper into their addiction, then the typical things happen. Their functioning breaks down.
And functioning's a funny word. It's one of those words we use a lot, like they're functioning, because they're functioning at a societal level. But how are they functioning personally? How is their family life going?
Well, right. We didn't. Yeah, that's true. We think they're functioning if they can go to work,
right?
And make it through the day and go home. But are they functioning at their optimum? Are they functioning emotionally? Absolutely not.
Yeah, last week we had a caller, somebody that's been using essentially for the last 30 years, and he said he was going to call back, so I'd love to hear from him. But he said he's been, basically using for, almost close to 30 years drugs, for prescription drugs. Now it's prescription drugs, but and alcohol. And he said he's functioning, and I don't know if that's really functioning. Like you said, how optimal is your life if that's what you need?
Yeah, if you have to go through life numb.
Right.
Think about that. That's sad. That's a shame.
Well, you say that they're not functioning to their optimal degree, which is very true. But what happens is that they feel like that is their normal. I know when Michael Jackson passed away, I did quite a few interviews at that time, and also during the Conrad Murray trial. And one of the questions I was asked was, how could Michael Jackson perform so well, because they had that video of him days before he passed away. How could he perform so well on all these drugs? And I said that the reason why he was able to perform was because of the drugs. When you get to a point where you're that addicted, it's when you don't have the drugs, or when people are called dope sick,
right,
that they can't function. So paradoxically, people start to function whatever level they're at with the drugs, even though obviously it's not as high of a level it would be if they were drug-free in the first place.
By the way, if you just tuned in, you are listening to KLEAN Radio. We have an amazing show tonight, actually, and I know I do say that a lot, but we actually really do tonight, because we're dealing with a topic that's huge right now going on in our society, which is people taking a lot of pain pills, you know. And the thing is, by the way, we're in the studio tonight with Dr. Gregory Smith, MD, and of course, Dr. Jason Coe, one of the world's greatest psychiatrists. But I think in a sense that people feel like it's okay with the prescription pills, because, you know, I remember when I was drinking, and I'm sober a long time, I had a certain amount of shame when I'd go to the liquor store every night and I'd stand in front of that guy going, you know, can I have, you know, and he'd see me scrapping my pennies together or my quarters together. And there was a certain amount of shame involved in going to get my alcohol. But in today's day and age, you don't even need money to go and get your prescription pills, because it's covered by your insurance. You just go there, maybe you give them $5 for your copay, but all of a sudden you have your high. And I think it's a crazy thing that I think shame isn't always a bad thing. You know, we want to, you know, there should be a certain amount of shame when you're actively using drugs.
Well, yeah, actually, shame, you know, I like to draw the difference between shame and guilt. There's a big difference. If somebody's ashamed, they don't make it public. They keep it to themselves. Right. They feel bad about it, but if they're guilty, then they begin to work on it and change. But shame is more running from the problem rather than facing it. Guilt is feeling bad about it and changing.
So I had a tremendous, so it was good. So guilt, let's go with the word guilt. I had a tremendous amount of guilt with going to that liquor store every night. And I think that guilt has been taken away from a lot of people by the pharmaceutical companies, by the insurance companies, because you have no problem. I mean, there's a lack of guilt with going to your doctor and getting drugs.
Well, you don't even have to leave your house. You can go to an online pharmacy, and depending on how good you are on your computer, you can get almost anything delivered to you.
Right.
So so there's no shame in that, because you don't even leave your house. But it's a huge business, and that's why there is so much of it out there, whether it's getting it legally or illegally.
And there are so many people out there right now that are listening. They're going through this, and I know this is one of the. Talking about this stuff, getting open and honest about this stuff is some of the hardest stuff in the world, because there is a lot of embarrassment to it. There is a lot of guilt, and there is a lot of all that jazz with coming out and saying, you know, I have a problem with prescription drugs. Because who do you even go to? Who do you go to when you have a problem with prescription drugs? Because a doctor was who you went to in the first place to get it. So you're in this quagmire of, I got it from a doctor, and now I'm addicted. Who do I trust? Because I don't trust the doctor.
You bring up a tremendous point, and
every once in a while I do. That's the rumor.
Well, that's a tremendous point, because herein lies the problem, is that usually it is the doctor that started the prescription, and the doctors themselves don't always know what to do. I think that the vast majority of doctors in this country do not really understand chronic pain and the whole cycle of chronic pain, then graduating to addiction or dependence to narcotics. And then even a lot of doctors that are pain management doctors don't understand that. So it is a very complicated problem when you say, where do they go to get help? And hopefully at some point we'll focus on that, you know, at some point tonight. But I think it's easy to talk about how bad the problem is, but people do need to have resources of where they can go to get help, because there's help out there. You just have to know where to get it.
Your resource, KLEAN Treatment Center, is a resource. And this is the thing, you know, about it is that, you know, calling up and saying I need help is probably the hardest thing for a drug addict and an alcoholic to do. It is that phone, you know, even when they're sober. You know, I heard somebody say one time say
that's facing the shame.
Yeah. And I heard somebody one time say alcoholics and drug addicts are predisposed to not getting on a telephone and saying I need help. You know, and the psychology in that, you know, the twistedness of that is they have no problem calling up the drug dealer and saying, I need help. But then the reverse happens, then they need the real help. That's a hard call to make.
Yeah, that's that whole moral thing. You know, I'm bad, I'm weak.
Right.
And a moral thing.
Right. And one of the my favorite things is when we say to people, you're sick trying to get good. You're sick trying to get better, not, you know, good, you know, bad trying to get good. And that was a huge thing that helped me, especially, you know, coming from the environment I came from and all that stuff. You know, you're sick trying to get well. And I think that's the important thing to tell people out there. If you are addicted and you are having a problem, you're sick.
That's right.
And you wouldn't blame somebody if their heart went bad.
That's right.
But all of a sudden you have a prescription pill problem, you have a drug problem, we say you're bad. You know, you have a sickness, but you're bad.
And hopefully that is changing, that people are really recognizing that addiction, prescription drug addiction, illicit drug, whatever, it is really an illness. It's not a simple thing where you can, you know, people that don't have the problem just say, well, why can't the guy just stop?
Right.
Can't he see all the harm? Well, of course they can see the harm, but it's not that simple. It's a very complex situation. It's brain chemistry, it's genetics, it's environment. It's a lot of things that make people addicted to any substance.
Yeah, and the other thing is it's not enough to detox them. You know, and in many ways, I say the work begins after the detox, whereas the lay public thinks that if somebody's detoxed, problem solved, they're fine, you know, go on and live your life. Not true. Not true at all. Yeah.
So well, detox essentially is the pill. Detox is the pill. You know, it's like that's going to, but it's, you know, stop taking the pill and then start moving on and saying, you know, getting help for yourself. That's the real. It's about, at that point, they have to change their lives. They have to deal with whatever it is they were using the pill for in the first place. And that's after, you know, it's not just the detox. You know, the brain chemistry takes a long time to, you know, get back to normal. You know, I say 3, 6, really probably more like a year, although most of it comes back in 3 to 6 months. Sometimes it could take 10 years, you know, to
find... Well, it can. Well, as you grow and mature, yeah.
But I often say that to people. It's like, you know, when they say, when people, you know, at the treatment center are like, they're 3 months, you know, a month sober, and they're like, why am I not feeling better? I'm like, you were sick for 20 years.
Right.
Intellectually speaking, 1 month, 20 years. It's not going to get better overnight. But part of the fun of being sober and living that life is getting better, and is finding out who you are. You know, that's a real gift.
I'm glad you brought that up.
Okay.
Because, yeah, it really...
I made another good point tonight.
You know, you're doing well tonight,
thank
Judah.
Thank you.
It is about finding out about yourself, and you really have something to look forward to, you know, when you get out of this, you know, hell of addiction. Yeah.
By the way, if you just tuned in, you are listening to KLEAN Radio. Give us a call at 800-222-5222. That's 800-222-5222. We're in the studio tonight with Dr. Gregory Smith and Dr. Jason Coe, psychiatrist to everybody and an amazing guy. I'm sure, Dr. Gregory Smith, you are too, but I've just met you, so I can't give you that stamp just yet. But one of the things you did ask about was the people out there that are listening. We know, we really do understand that it's like really rough out there right now. People are struggling financially. And especially if you have a drug problem, there's a good chance you're probably struggling too. So one of the things that we do offer people is that we say, you know, if you can't afford our outpatient services, we will gladly figure out a way for you to get in. And that's one of the things we like to do at KLEAN is we like to give back. You know, 2% of our bed, you know, 10% of our beds a month, Doc. You are one of the owners. You've given away.
That's right.
And that's a pretty awesome thing.
And I see them as well.
Yeah, and you see them as well. You know, that, you know, here's the thing. It's we were talking about before why doctors don't want to get you off of drugs is because they need the continuum of care. Pain management doctors that want to, you know, that are continually giving you meds want you as business every month. One of the goals of every treatment center is that, yes, we want to help you, but we also want you to move on. We don't want you back 66 times that year. That's not the goal. And I think a lot of doctors have that fear.
That's right. I always tell people that if I'm doing a good job for you, you shouldn't be seeing me that often, maybe at the mall or something, but not in the office. And unfortunately, it's the opposite. Most doctors are making their money by return business. And again, I'm not trying to slam the doctors because a lot of times they just don't know what else to do. I mean, when you see someone that's in horrific pain and they're in your office and they want a pill, it's hard to just say no. But if you don't know what else to do, that's why it continues every month. Here's another prescription for OxyContin or Norco or whatever. So a lot of it's just the lack of knowledge or education for that particular physician or that clinic.
What do you think, Doc?
I agree.
That's
well, I can't improve on that.
Yeah, no, I mean, and I think the people out there that are listening, that there are we're not bashing on all doctors. There's some amazing doctors. There are a lot of amazing doctors out there, and it's so amazing that we have our car breaks and we call up 42 people to find out a great mechanic. But yet, when it comes to healing ourselves, we're like, okay, I'll take the first guy I see. And it's okay to go doctor shopping in the good way.
In that sense, right?
Yeah, it's okay to find the right guy. It's okay to see a therapist and say, I don't like you, and find a new therapist. You don't have to stay with. It's like dating. Getting healthy should look like dating sometimes. It could be a lot of one-night stands until you find that perfect relationship. And it's okay to say to somebody, we're not good together.
You got to find someone that works, right, that you're comfortable with.
But how often do we meet people out there that are saying, you know what, okay, I'm going to go with you?
True.
And I mean, yeah, sorry,
there's too much mystery about the medical care system and medical delivery system, and it's fragmented. We need a lot to. There's a lot to do to clean up our act.
Yeah,
and I'm afraid to say that. And with health care reform, it's really insurance reform. They're beginning to look at paying for outcomes, although then we have to define what's a good outcome. But I think ultimately the care system should go for outcomes and not be based upon procedures or what you do.
Well,
we'll get more cognitive medicine going.
I agree with you. I think that our medical system at this point has been very symptom treated based. So you go to the doctor and you can't sleep, so here's a pill for sleep, and they come back and say, I'm sleeping great, and the problem is solved. But it isn't, because now they have to take that sleeping pill forever. If they don't take that sleeping pill, they can't sleep. So we have to fix the problem and not just treat symptoms.
That is a great point. You're listening to KLEAN Radio, Richard. I'm Richard. We will get to your call right after the break. We're in the studio tonight with Dr. Gregory Smith, co-writer, co-producer of American Addict, What Pills Are You Taking? We're in the studio also with Dr. Jason Coe. We will take your calls after the break. You are listening to KLEAN Radio.
Are you or someone you care about addicted to drugs or alcohol? Addiction ruins lives and destroys families. Bring an end to the pain and suffering by calling KLEAN Treatment Centers. KLEAN has helped people from around the world break free by not only treating the addiction, but the underlying causes and providing vital aftercare so people can get clean and stay clean with no gimmicks and no false promises. If you need immediate assistance or just have questions, call KLEAN Treatment Centers for guidance. A much better life awaits.
Welcome back to KLEAN Radio, and it's not Andrew tonight. It's my co-host with the most, Dr. Jason Coe.
Yes.
Yeah, a good man. And I got to tell you, to the people out there who are listening, if you're in pain right now and you're in trouble, you give this guy a call. He listens, and he doesn't judge, and he doesn't he evaluates, but he doesn't judge, and it's a pretty amazing thing for a psychiatrist. And in the studio, too, we have producer, writer co-writer of American Addict, What Pills Are You Taking? And let's go to Richard in Washington State. Welcome to KLEAN Radio, Richard. What pills are you taking?
Hey, hi, gentlemen. Yeah, I take Vicodin and morphine sulfate with some psych meds. But I got an argument with you guys.
Okay.
Without those pain pills, I'm basically unfunctional, and I'm in misery. And I'm not an addict, and I may be addicted to them or codependent on them. So I think maybe you guys ought to be careful about talking to the public out there, blanketing everybody as an addict because we're taking this thing called narcotics.
Well, Richard, just before I let you get to the doctors, we didn't say that. We're actually talking.
That's the feeling I get.
Right.
That you got when you guys are talking over the radio.
But I will let the doctors answer your question, Richard.
Pardon me. Sure.
Gregory, you want to go first?
I would love to take this because, sir, I know exactly how you feel. I treat 90% of patients that I treat have chronic pain, and I agree with you. A lot of patients can't even get off the couch, or completely unfunctioning with their medications. However, I also try and impress on people that taking these medications with no endpoint in sight has a lot of other problems. And so there's a phenomenon called narcotic-induced pain, where long-term narcotic use can actually perpetuate or actually increase chronic pain. So what we found is a lot of times when you detox, and when you talk about detox, it doesn't mean that you're a drug addict. It means that people can be dependent. Detox doesn't mean that you're detoxing for addiction so much to speak, but just to get these substances out of your system, clear out the liver, the kidneys, the bile system, etc. And then sometimes I have found that people that have been in horrific pain, have had multiple spine surgeries, etc. for 8, 10, 12 years. Once we get all this stuff out of their system, their pain actually goes away because they were under the influence of narcotic-induced pain phenomenon. So I want you to take that in consideration, because I, for one, do not think that the majority of chronic pain patients are addicts in the strictest sense of the word, but they are dependent, and there's a difference.
Well, I appreciate that, Doctor. I do practice what you just said. I go sometime in the detox because I do feel that dependency where I want to stop the dependency, feel my real pain, and then if I have to, I go back to the pain medication. So I appreciate what you guys are doing out there.
But Richard, can I ask you a question?
Yeah, sure.
How long has this been going on?
20 years.
That is,
motorcycle accident.
And that's a long time. I'm gonna speak from personal experience of saying that, even psychotropic drugs, whether it's you could attest this, Lexapro, or every couple of years we should be reevaluated.
Exactly.
Yeah.
We should always.
Well, I do. I go through periods where I stop taking them. I do the best I can.
No, but I mean by a doctor, Richard.
Oh,
that
okay.
we're a doctor.
No, I've had several doctors. The last thing they told me is to amputate.
Wow.
And, that's what I don't want to do.
Yeah.
Maybe I should, and maybe that's my fault.
No. I mean, that's a horrific. You're not looking at,
It's a tough decision. Yeah.
Richard, can I ask you? I mean, have you only seen one doctor?
No, I've seen many doctors,
and they all say the same thing.
Doctor at the University of Washington, where they're going to give me a prosthetic. So no, it's tough to have a chronic pain. It's no fun.
No, I can't imagine.
It's a joke. Yeah.
And Richard, I would suggest going to Gregory Smith's website, and I just met the guy, but he seems to know what is going on with this stuff, and even just to give, I'm sure there's so many other drugs out there that you could cycle them off, and I don't,
There's a lot of options in that, and like we were talking maybe off on break, but there's just even a lot of pain physicians in this country really don't have a grasp of chronic pain. Most pain clinics and most pain doctors, it's pills and injections like epidural steroid injections, facet blocks, etc., or then you graduate into intrathecal pumps and intrathecal simulators and things of this sort, or implantable devices. And that is just one phase of pain management. The whole integrative pain management brings in a whole other host of things that most people have never been exposed to if they go to a conventional doctor.
Right. I am with a pain management specialist, so I'm looking at regards. Hey, I appreciate the words out there. Thank you for your time.
Hey, Richard, thank you very much for the call. I want to, he actually raises a great point. And the point, we deal a lot with mental health at KLEAN, and one of the things we always say is it doesn't matter really what came first, the chicken or the egg. Were you mentally ill, then became addicted to the drugs, or you either took the drugs or you became mentally ill? A lot of times, this is normal Americans we're talking about are getting majorly addicted in specific to the drugs we're taking. We're not comparing, this isn't a comparison game. But what we're saying is these are some extremely addictive drugs. Just in their own, these drugs are addictive.
Yeah, what I say is the brain was never meant to mediate the effects of these powerful drugs.
Right.
It just, it's overwhelmed. And, it essentially causes a frontal lobotomy, may be too strong a word, but, it reduces the functioning of the frontal lobe, which is the executive portion of the brain. Like, suddenly the best you can do is muddle through life.
Yeah.
If that good.
And I don't care who you are. You could be the healthiest man in America. If for every day for 1 year, you took Vicodin or you took another painkiller, after that 1 year, your body would have a physical chemical reaction if you stopped taking that.
Of course. Yeah.
And you lose brain matter too. It's been shown that chronic pain and taking narcotics, you actually lose brain matter every year at accelerated rate. So if you have chronic pain and you're taking narcotics, it's a double whammy. So You speak about like a frontal lobe lobotomy. It's true. People lose judgment, so they'll do things that they normally wouldn't do under the influence. One of the most common things that I hear once we get people off a certain or off medications is they feel like the fog has been lifted. They feel like they've been living in a haze for so many months or years or decades that they've been on these medications, and they have been living in a haze. So it's a great thing when people can actually feel normal again.
That's very true. I've seen that over and over.
And by the way, Andrew, our co-host, is listening tonight, even though the NFL started tonight. He's a little upset with you for stealing his lines. But if you just tuned in, you are listening to Clean Radio. Give us a call. The number here is 888-800-222-5222. That's 800-222-5222. We are in the studio tonight with Dr. Gregory Smith, co-writer, producer of American Addict. What pills are you taking? What are some of the pills that people are taking? I mean, that come under dangerous? Because
Yeah, well, there's a lot. We cover some of this in the film, but I think that the biggies are OxyContin and Xanax, and Vicodin and Norco, in terms of narcotics and anti-anxiety pills they're horrifically abused. And again, these drugs are made in the lab to work really well, and that's why they're so addictive. And I've found, for me personally, it's actually easier for me to get people off of heroin than it is OxyContin.
I agree with that.
Yeah, and there are other psychotropic drugs and there's all kinds of other drugs, but my specialty is in the narcotics, and they're very difficult. Methadone's another one that I've had that's OxyContin and methadone are the two harsh narcotics that for me to get people off of.
Also, when you talked about people getting off of pain pills, the opiates, and finding that their pain goes away, the same goes for the benzodiazepines, Klonopin, Xanax, that their anxiety improves. Once they've gotten through the detox and a couple of months down the road, the anxiety actually is better.
Something I don't understand.
It's a paradoxical effect.
Something I don't understand is, let's say you take a pain med for something you're in pain with, right? All that pain med is not healing you. It's just allowing you to, move around. It's
symptomatic treatment.
Are you getting worse because you're, let's say I have a broken leg and I'm shooting it up with cortisone, but I'm walking on that broken leg. Wouldn't it stand to reason that the leg was getting worse?
Well, Gregory can comment on that, but I think people are unaware of the normal pain signals that they're getting from their body. And pain means that there's damage, and so if you're not feeling it, you could very well, overdo it.
Which is no different than somebody getting sober and then automatically trying, certain approaches, as far as, not the therapeutic approach, the spiritual approach, and if you need meds. But if you're constantly, pushing your feelings down or pushing that pain down, are you really getting the help you need?
Oh, of course not.
Right. Well, there's good pain and there's bad pain.
Right.
I mean, if you're having heart attack, you want to feel that pain so you'll get help. You use the example of a broken leg. I think when you're having surgery or you have a broken bone, there's nothing wrong with taking strong narcotics. If I'm having surgery, I want some morphine or Demerol. But the problem is that they move out of the area from acute pain into chronic pain. They become the solution instead of the Band-Aid until you fix the problem. And that's where all the addiction happens. If you give someone morphine or Demerol or something after surgery, most postoperative pain happens in the first 72 hours. But how often do you see people leave after a minor procedure with 60, 90, 120 Vicodins, Norco, or OxyContins? And that is enough to get a lot of people addicted, or it sits in someone's cabinet and then the teenager or somebody comes over for dinner and they get your pills. That's the problem.
And by the way, if you just tuned in, you are listening to Clean Radio. Give us a call at 800-222-5222. That's 800-222-5222. We're in the studio tonight with Dr. Gregory Smith, co-producer, co-writer of American Addict. What pills are you taking? What got you to, so you're an anesthesiologist to start. Was it like striking to you, like what pills people were taking?
Well, it was at the beginning, but I thought, I was classically trained. I went to Washington University Medical School in St. Louis, and I was in very academic situations until I opened my own thing, and I looked at it was normal because that's all I'd ever seen was if you have this problem, you have this pill, and you have this problem, you have this pill. And if you have 10 problems, you may have 10 or 20 pills, and
right.
It was a normal thing. But then when you start seeing the long-term effects after I was in practice for more years and seeing that people are getting worse, they're having collateral damage from these pills, they're having side effects from these pills, and then we're treating the side effects of the pills with more pills, I'm thinking this is insane. And unfortunately, most people don't vary from their practice because that's the only way they can make money. So they continue to do the same things that they do. But for me, I felt like, look, I went in this to help people. So even if I have to lose money or not make any money for a while, I have to learn how to do something right, do something different. Because ultimately, if you're successful, then the business will flourish. And so that's sort of what's happened is that we sort of found ways to make people better without just giving them more pills.
Doc, what's your opinion on that?
If you do a good job, you'll have a good practice.
Right, but that's people's biggest fear, I think. We were talking about before is doctors' biggest fear is if I do a good job, then I'm not going to have that client again.
We're
not
in
realizing
the business of putting ourselves out of business.
Right.
But there's no end to,
There's enough gold. I mean, and what I mean by that is if you're good at what you do, people are going to talk about you because you're good at what you do. And I think that's sadly what a lot of that profession has come to, with pill popping, is that everybody knows the doctor that prescribes. We've had them in California. We have the Dr. Feelgoods out here that everybody knows, hey, give Dr. Feelgood a number, a call, and he'll give you what you need.
Well, what you think you need.
Well, right, what you think you need. And so how long did this movie take to shoot?
We shot this movie over about 9 months in about 12 different states. Of course, the post-production, the editing takes a long time. But I think it's a very special film. I think you hear people all the time say this movie can change your life. I think this movie can actually save people's lives or someone that they care about's lives. It's that important, the information, and it's really showing how this has happened on purpose, like how as a nation, it's not focused on street addiction or showing people shooting up or getting high. It is the whole process, the connection between the FDA, the federal government, the media, the doctors, everything, big pharmaceutical companies, everything linked together to almost ensure that when you go to the doctor and say, I can't sleep, instead of the doctor saying, well, have you tried some sleepy time tea? Do you take a bath? Instead of saying that, you're going to get Ambien or Lunesta.
Right.
Or asking about sleep hygiene and just sort of the basics of getting a good night's sleep.
Yeah.
It's a great point, yeah. I mean, it's, what are you do? Are you drinking coffee past 6?
Right. Yeah, I mean, in a lot of ways, people need education, and this sounds like an exciting movie.
Well, you say they need education. You're right, and I do think it's an exciting movie. Thank you, but again, when people need education, that takes time. And in managed care, with doctors getting shrinking reimbursements, they don't have time. They're seeing 50, 60 something patients a day to get the same money they got 5 or 10 years ago for seeing half that many patients. They don't have time. So a lot of times that dialogue doesn't happen. They come in and they're just saying, here's a solution. Here's your sleeping pill. They don't take the extra 5 minutes to find out that the guy's brewing espresso every night at 10 o'clock before he goes to bed. And that's a truth that happened to me. I had a patient, they had seen multiple doctors, multiple medications, and the guy simply had gotten a new espresso machine, was trying different recipes every night before bed.
I'll pretty much say I'm guilty, and that's why I brought it up. For years, I would always say I can't sleep, but it also didn't help that I'm drinking coffee at 8 o'clock at night or midnight, But that's one of the things when you do get sober, one of the things you do is you stay up late, you drink a lot of coffee, you go out for late night meals. You go, and that's one of the fun parts of sobriety too, but it was also a detriment in some ways because I wasn't sleeping.
Right,
and
coffee's part of
it's part
social,
of the 12-step social movement, and
the after meeting.
Which is great.
Yeah, it is.
And so, how many? What was the worst state? Of the 12 states you were in, what was the worst state you saw?
Florida. By far. I mean, they had just done that whole OxyContin highway thing where there was no regulation, and at the time, about 80, I think it was about 80 or 85% of the nation's OxyContin was being written out of one county, Broward County in Florida. It was amazing. Just think about, so just one county writing all those pills, 85% of the nation's OxyContin, and of course it was legalized drug dealing. I mean, there were literally billboards every block, hundreds of pain clinics. Now they've cleaned a lot of that up now, but hundreds of pain clinics where you simply walk in and just say, I got pain, and it's cash and carry.
Right.
I mean, it was ridiculous.
Sort of like the pot clinics that we have opening up here.
It's totally, similar, yeah.
And so if you just tuned in, you are listening to Clean Radio. Give us a call at 800-222-5222. That's 800-222-5222. We understand this is one of the hardest things to talk about. One of the questions I want to ask you is, how do you know if a loved one is, there are a lot of people that, I was joking about the show House, but take that out of the equation. If somebody is abusing, pain meds and they're married, it's a lot easier if you're married or you have a girlfriend or you have a son, and they're using crack. You could easily say, well, you're a crackhead. You see it. There's that, you see it, but with prescription pills, you almost have the fight. The addict has the fight, the ability to say, you don't understand, it's legal.
And they have and often they have, and usually, especially if they're a pain patient, they have a reason to take it, and it's a very hard line. It's a very fine line, and so you have to look for certain clues, like, are they over medicated? Sometimes when people are being prescribed medications legally and for chronic pain, if they're not functioning, if they're on a couch drooling all day, that's not effective pain management. They're being over medicated, or maybe they're taking more than was prescribed. So in effective pain management, even if you're using chronic narcotic therapy, the patient should be able to function. They should be able to move around, do their housework, go shopping, do the daily, what we call activity of daily living. If they're not doing that, then there's a problem.
If they're not nurturing, if they're not, because because I'm sure, that's, the old addict argument is, well, I'm taking care of all the bills, I'm doing all this stuff, but you're actually not even being really present.
Yeah.
So if you're not being present when you're using these things, I would guess that's also a good...
Well, yeah, we have people that have, for instance, and I'm not trying to slam the drug Ambien, but there's a tap with other drugs, but it seems like for that drug specifically, a lot of people taking it, sleepwalking, going shopping, et cetera, not remembering anything.
Let's go to John in L.A. Welcome to Clean Radio, John.
Oh, yeah, thanks for taking my call.
You got it.
Yeah, I just was wondering, are there prescription pain medication that is non-narcotic that could be used instead of a narcotic if you have some kind of a chronic back pain that's not real bad, but but stuff that doesn't have like aspirin or Motrin in it, that type of stuff.
Well, there are lots of alternatives. I'll give you an example. A lot of people there's different types of pain. A lot of people have neuropathic pain that's burning, shooting, throbbing, and there are drugs like Lyrica or Neurontin, which is also gabapentin, that's prescribed. But something like kava, which is a root, in the right doses can actually control neuropathic pain very well, and I actually substitute that often for drugs such as Lyrica and gabapentin. Now, kava has some issues with long-term use also, but it's definitely not a prescription drug. So there are a lot of, it's not just medications, there are a lot of different technologies that are new that a lot of people haven't heard of, such as nanotechnology, something called Nexlin, which causes deep brain stimulation that's not invasive, that can help for chronic pain. There's a lot of things out there that can help people, but the majority of people just don't know about these things. And pills are a lot easier to give, and that's why they get them.
John, is this a personal question, or?
Yeah. I mean, I was asking about a prescription, pain medication that is not a narcotic though, but also doesn't have aspirin or Motrin, something like that could be substituted if you don't want to take, like Vicodin and that stuff.
Right.
That would help with some type of a minor, back pain that you've had for a long time. That's not debilitating, but it's enough to where you sometimes you would like to take something so it allows you to do your normal activities without having, being in pain.
Well, there's medications like tramadol, which binds the narcotic receptors, but it's not technically a narcotic. And I'll go so far to say is even if you have pain that comes and go, I don't think it's a problem for someone to take a Vicodin here and there. I mean, if someone's taking a Vicodin once or twice a month for some flare-up of pain, I don't look at that as a problem. I don't think these medications are evil. The evil part is when they're used chronically, daily, all day, every day, with no other endpoint in sight and no other plan other than the pain pill.
John, can I ask you a question? Would you happen to also be sober, or?
Say that again?
Are you sober by any chance? And there's a reason I'm asking.
I mean,
that.
are you saying, do I drink?
No, yeah, I mean, because one of the things the reasons I'm asking that question is a lot of time people that are in sobriety, including myself, have a problem with pain. And not because I never abused pain pills, but I've heard these horrific stories like we're talking about tonight with people getting addicted. I just want to share the story that this year I had horrific tooth pain, and Dr. Ko actually, prescribed to me tramadol. And it didn't work. And I'm like, and it just, I was in such bad pain that I was like, I got to take what I got to take. I mean, this was a year of horrific pain in some ways. And so, John, that was the reason I asked that, was because my fear of taking certain things was because of my sobriety being in,
Oh, no, I've never had a drinking problem. I don't drink at all.
So go with what Dr. Smith is saying. If there are things you have to take, and try them out, and give him a call. Go through somebody's practice like him. There's nobody better, actually, for something, buddy like you, than Dr. Smith, because in a sense, you've seen the bad.
Yeah. So you're saying tramadol is a alternative to a narcotic?
Well, it binds to narcotic receptors. It's a strange drug, but what I'm saying is that taking a medication is not a bad thing. And I'm a lot of times people think I'm bashing medications. I'm not bashing. It's similar like the gun argument. I'm not bashing that. I'm bashing the way it's used. So if someone has a bad flare-up of pain and they need to take Vicodin for a day or two and then they stop once their pain is under control again, there's not a problem with that. But the problem is when people are taking Vicodin 3, 4, 6, 8, 10 times a day, that's when it's a problem from a variety of directions. So that's all I'm saying.
Yeah, I just was worried more, with the Vicodin stuff, not so much with long-term as far as addiction, but as far as, because I know they put Tylenol in it, and I know you hear a lot about Tylenol is bad for your liver. So that's, but my concern would be about taking anything, with Vicodin that has a Tylenol in it that could be damaging to your liver in the long term.
There has to be a large dose acutely to give someone liver problems. And again, if you're taking it long term, if you're taking it off and on, there's really no problem. It's the acetaminophen problem is when people are taking huge amounts in a short period of time, or taking pretty big amounts over a long period of time. And those are the people that have to be monitored with blood work, 2 or 3 times a year. But for you to take a Vicodin here or there, there's no problem with that.
Yeah. Okay, well, I'll talk to the Dr. Austin about the tramadol and see if he...
Tramadol.
Yeah, tramadol, if he would recommend that, I guess.
Okay, John, thank you so much for the call.
Thank you.
By the way, just so I get this straight, isn't tramadol banned in certain countries?
I don't know. I don't think so.
I thought it was.
It's generally safer than opiates.
Yeah, it didn't work for me though. I got to tell you, but you were trying, and that's one of the things I love about that. Why I could swear by Dr. Ko is because you could, I was in a tremendous amount of pain, and the type of pain I was in. If I was actually complaining about it, it was real pain. But the last thing you wanted to do, because you understand addiction and you understand, pain and all that stuff, was you putting me on something stronger was the last thing you wanted to do.
We always want to be careful.
Right, yeah. But I wish what we're talking about on this show tonight is that sadly, so many doctors aren't going with that thinking.
Well, there's one really quick thing that I think is super important, and that is DNA testing. We can do, and there are places that you can get DNA tests that can show your sensitivities to a variety of different drugs, whether it's narcotics, anti-inflammatories, antidepressants, and you can look at a person's genetic code and see if they're going to respond better to a certain drug or may have a predisposition to be addicted to a certain drug. So that helps too, and that's a one-time test because your DNA is your DNA.
Right.
Yeah, I think that's really good. And I do that with psychotropics, and you can find out how they metabolize and what they're likely to respond to.
So I think in essence what we've been saying in this whole show tonight is that if you have a problem and no one else can help, maybe you can hire the A-team. I won't do that. But if you have a problem, you know, get help. It's time to try. It's, you know, and if you're a loved one out there and you're conflicted and you're going through a rough time because, you know, like I said, it's easier, you know, you see the crackhead, you see the food addict, you see all these things, but with the prescription pills, it's harder because they have a defense. You can't defend if your husband, you know, if you're smoking crack and somebody says to you, you can't say, well, it's social. It's for pain. But when it comes to pain meds, people are easily able to say it's for this pain. But they've had it for 10 years. They've been using that, you know, that pill, and they've been getting their doses up. And
they're getting it from an authority, a doctor.
That's exactly
who's supposed to know what he's doing.
You're right.
Yeah.
It's funny what we trust doctors on. Everybody doesn't trust a doctor, but they trust them when they give them, the, you know, these
what
pills
they want.
when they want to. You know, it's a fascinating place we live in. So and this is, you know, this goes more to the people that are married or loved ones, or so, you know, if you suspect something, I always say if you have to ask, you know the answer. You know, and, you know, do I look fat? Probably, yes. But the question is, do they have a problem? If you're asking, the answer probably is yes. And we are running out of time, but if you do have that question, please give us a call. It's 888-601-6040. That's 888-601-6040. It's an absolutely free call. We're in the studio. I want to thank again Dr. Gregory Smith, co-producer, co-writer of American Addict. What pills are you taking? How do people get this movie?
It's going to be out in about 6 weeks on video demand, like Hulu plus Netflix, that type of thing.
And we're actually going to have you back on when that comes
Great.
out.
Yeah.
And it's really cool. How do people find you?
Well, they can go to painreliefgroup.com. For more information on the movie, it's AmericanAddictTheMovie.com. So those are the two quickest ways. And my Twitter and Facebook is connected to both of those.
And it's an absolutely free, you know, you're not, you know, you're one of those, I'm sure you take you know, you consult and do all that jazz.
Yeah, I'm really trying to help people with information. I'm really not trying to recruit patients. I'm really just trying to get people better overall, because it's an epidemic problem.
Dr. Coe,
I'll say that Dr. Smith, he knows what he's doing.
Yeah.
I've just met him, but I can tell that this guy is an excellent physician.
I see a bromance in the works. I want to thank everybody out there for listening. I want to thank Mark over there. I want to thank Steve behind the boards. You guys are the best. And I want to thank Patrick. I want to thank everybody out there that's listening tonight. I want to thank I miss Andrew. I don't know when he'll be back, but when I have word on that, I'll let you know. The discussion continues at KLEANRadio.com. Thank you all.
Are you or someone you care about addicted to drugs or alcohol? Addiction ruins lives and destroys families. Bring an end to the pain and suffering by calling KLEAN Treatment Centers. KLEAN has helped people from around the world break free by not only treating the addiction, but the underlying causes and providing vital aftercare so people can get clean and stay clean with no gimmicks and no false promises. If you need immediate assistance or just have questions, call KLEAN Treatment Centers for guidance. A much better life awaits.